thanks, Hilda, for the introduction. And it's a great pleasure to be joining this very important meeting. And I think it's a real expression of the global solidarity that all of us have with this shared pandemic. So I'm just being an academic, of course, I have to have some PowerPoint slides. So I'll just switch over to those. So today I want to really talk about the New Zealand experience with COVID-19 elimination and what some of the implications may be. So what I want to do, and I'm going to go through this obviously very quickly, but there will be a chance to discuss some of the details, talking about the strategic choices countries make, what is an elimination strategy, its impact, some key questions, and what I think are some of the points that I hope can generalize from the New Zealand experience. So like many of us, you probably remember where you were when you first heard about this pandemic and what it meant. And I know certainly in January, it was clearly going to be a global pandemic quite early on. But then there was the more positive news from a joint mission to China, which showed that it could be contained and eliminated. And then a third moment for me really was when the pandemic started to become established in New Zealand, realizing we didn't have the infrastructure to eliminate it, so we needed a lockdown at that point. So if we go back to fundamental infectious disease epidemiology, there's a real fork in the road here when you choose between control or elimination. Most infectious diseases, there's some degree of control, and the traditional approach to pandemic influenza, of course, is a mitigation approach to avoid it overwhelming health systems. Often countries have moved to a suppression approach to try and dampen down cases. But the other approach is elimination, and this is a really quite a distinct fork in the road here, and that's reducing to zero in a country or region. And we're very experienced with this. We've done this with smallpox, obviously, we're finishing it with polio, and the UK, like New Zealand and other countries, has a measles and rubella elimination approach. And at a global level, you may be able to get to eradication, but that's a huge bar to reach. So this is showing the same thing in a more detailed way. And this is in a paper we just published in the BMJ just before Christmas. And this is freely downloadable if you want to see more details about how you can think about the strategies. But the big benefit of elimination or exclusion, if you're an island, is that you can return to a carefully managed new normal within 2 to 3 months. And that's the experience of countries pursuing this approach. Otherwise, you're trying to coexist with the virus, which is, as we've seen, a disaster for most countries. So early on in February, March, we became convinced that elimination was possible. We published an elimination strategy, and our government basically headed off in its own direction, I think still unique really in the OECD, when it decided in March that it would go into an intense lockdown to eliminate the virus, and we had only 100 cases and no fatalities at that point, which I think was very courageous by our progressive government. So elimination strategy, it's actually very simple what's involved. You exclude cases, you keep it out, so you need to manage your borders. You need to have case-based approaches to stamp out cases, and that's testing, tracing, isolating, quarantine. And then you have to have ways of dampening down community transmission. So hygiene measures and reducing contacts, and this is where lockdowns come in. And we've now got a new tool, of course, vaccines. And remember, elimination usually needs vaccines, but it doesn't have to have them, as we found in New Zealand. So this is showing the elimination strategy here. This is border management, where we've seen that it's a remarkable change, of course, going a 99% reduction in people coming across the borders, and now going through a 2-week quarantine process. This is the second part, the contact tracing, and this is showing the high volume testing that drives contact tracing, and that's been essential in New Zealand, but that took time to build up. And the third part is, as I was saying, is dampening down transmission in the community. And of course, with a respiratory pathogen where many infected people are asymptomatic, you actually do need masks, mass masking traditional measures are useful, but they're not enough. Like staying at home if sick is important, but some people are asymptomatic and so on. For my efforts, I'm now, my cartoon image is now on the packaging of one of the masks sold by the National Museum. I'm not sure if it's a good likeness or not, but in terms of the other component of physical distancing to reduce transmission, we early on adopted a 4-level system, which includes level 3 and 4, essentially a stay-at-home order. So one of the things that's interesting in New Zealand, our average level of lockdown has been amongst the lowest in the OECD. And it's because we used it very strategically early on. And this is showing the Oxford Stringency Index, which you can download and generate this graph for every country in the world in just a few minutes. But it showed that New Zealand had the most, one of the most intense lockdowns for 5 weeks, and then less intensity for 2 weeks, and we emerged into a virus-free country. We had a brief period of lockdown again when we had an outbreak, but overall the level of lockdown was typically less than the UK, US, and Sweden, even though there are people still in New Zealand who think, oh, we should be living like Sweden in a society which does not restrict people's activities. So this is showing rush hour in Wellington on the main highway into town, which was a remarkable image which we could see for a few weeks. If you hopped on your bicycle, you could go and take these photos. This is showing the, looking at the impact of the elimination strategy. This is, again, a paper you can download freely from the New England Journal of Medicine, which shows we were on the exponential part of the curve. We were switching from imported cases to local transmission. And this is showing phasing in border management, controls of on community transmission, and case-based approaches, and various forms of health and income support. So one of the I guess the crudest measure is COVID mortality per million. This is showing in New Zealand we've had 25 fatalities, so 5 per million. So it's roughly 100 times less than the average for the OECD. So key questions about the elimination strategy: can you sustain it? Does it protect the economy? Is it generalizable? And can it be done better? So this is showing the question of sustainability. It has been sustained in New Zealand. These are showing, this is up to the present day, these are showing people arriving and put into managed isolation quarantine at the border. That's the blue. And this is showing where we've had an outbreak and we've had the odd case of local transmission linked to quarantine facilities, and they've all been extinguished using mainly contact tracing measures. So it is very sustainable.
Can I just tell you, you have 2 minutes?
Sure, thanks. And in terms of resurgence planning, that's a key part of sustaining it. The second point is, do you have to sacrifice your economy? No, you don't. This is showing, and again, this is in that BMJ piece if you want to download it. It's showing how we've got markedly lower mortality, but also economies have contracted far less in countries pursuing elimination than in countries trying to live with the virus. That's mitigation or suppression. Is it generalizable? Yes, it is. This approach is the dominant one used in Southeast Asia and the Pacific region very successfully, with the occasional, you have to have the occasional setback that is part of it, but all these countries are largely sustaining elimination.
1 minute, Michael. 1 minute, Michael.
Well, this is generalizability to other places. This is showing that in Victoria, they were able to, when they had higher rates in the UK, they were able to basically eliminate the virus again using an intense lockdown for several weeks. So it can be done even with relatively high rates. It also prevents other infectious diseases. This is showing that we eliminated our seasonal influenza epidemic this year in New Zealand. And we also eliminated our excess winter deaths and prevented about 2,000 deaths overall. And all
Michael, can you wind up? Michael, please, can you wind up? Okay.
And we can learn lessons from Taiwan that have done very well. And finally, in conclusion, it's preferable, elimination is preferable to mitigation and suppression. It's sustainable. And it is probably the preferred approach for emerging infectious diseases more generally. And these are some of the attributes that support successful elimination: science, political commitment, infrastructure, public engagement, and having a suitable safety net for vulnerable groups. Thank you.